Hi everyone, I'm Laura Walton, President of the Ontario School Board Council of Unions. Since the death of Sister Ingrid Salt, the CYW who passed away on November 18th from COVID-19, my colleagues and I have grappled with some difficult subjects. One of them has been how or if Ontario schools can be made completely safe places to learn and work in a pandemic. As education workers, we focus on health and safety. In the case of COVID, it's about eliminating the risk of infection and transmission in our workplaces. At the same time, we know our schools aren't designed to prevent the spread of COVID. They also fall under the jurisdiction of local or regional public health units, and public health's job is to mitigate risk, not eliminate it. Public health balances the threat of COVID in schools against the benefit of in-class learning. But that doesn't mean it's the best barometer for keeping students and workers safe in schools. And we are seeing that the transmission of COVID in schools is a significant problem. What we don't know is how schools are contributing to community transmission. That's because the provincial government leaves schools out when it calculates the rates of transmission of COVID-19. This wasn't a problem back in August when schools weren't in session, or in September when they had just reopened. Back then, the province transmission rates were low and dropping. But now we're dealing with rates that are widespread, and we can't say for sure that people aren't getting it from schools. So just when the government should be getting more rigorous about stopping the spread of COVID in schools with more testing, more protocols, more staffing, it's taking its foot off the brake. I'll give two examples. First, the 500 public health nurses hired to work with schools during the pandemic. In the government's announcements, we were told that these nurses were going to help reduce the spread in schools if transmission was in the community. They were going to work with small families of schools and liaise, educate, and support parents as well as staff. Yet I don't know of any union that's had any meaningful engagement with a single one of those 500 public health nurses. The Ministry of Education can't even tell us what they do. That's been left up to the public health units to determine. And as we've seen, public health has a very different focus than we do when it comes to making schools safe. Another example is the government Support for Learners program. $380 million so that some, but not all parents, can offset their children's school expenses. This money might help some families, but it's also a really inefficient use of funds, and it does nothing to stop the spread of COVID in our schools. $380 million could have been used to open more space in schools and reduce class sizes. It could have made schools cleaner and supported student learning. It would have paid for 6,700 extra education workers, custodians, EAs, student supervisors, ECEs, all jobs that the government named as priorities for opening schools safely during a pandemic. So if we don't have a government that will invest in extra measures, where does that leave us? As union leaders, we will always walk a line between keeping members' jobs safe and keeping members themselves safe. At the same time, we're parents, and we know that closing schools puts an enormous burden on families. But that shouldn't come at the cost of workers' lives. And we are always working under the unspoken threat of privatization and contracting out of our work. None of these problems has a simple answer. We know we have to manage these tensions, but it would be nice if we had the backing of the provincial government as we look for the best ways to do just that. In my next video, I'll be taking a look at how a succession of governments has gotten us to this point.